Restless Legs Syndrome, also known as Willis-Ekbom disease, is a neurological disorder characterized by an irresistible urge to move one's legs or other body parts, such as arms or torso, to relieve unpleasant sensations. Restless Legs Syndrome can lead to sleep disturbances, daytime fatigue, and impaired quality of life. Restless Legs Syndrome is a condition that causes uncomfortable sensations in the legs, which leads to an irresistible urge to move them. These sensations often occur when the person is at rest, such as when sitting or lying down, and can range from tingling, itching, crawling, or prickling sensations. The symptoms typically worsen at night and can lead to sleep disturbances, which may result in daytime fatigue, irritability, and difficulty concentrating. The symptoms of restless leg syndrome can also affect other body parts, including the arms, torso, and head. Causes of restless leg syndrome. The exact cause of restless leg syndrome is unknown, but research suggests that it may be related to abnormalities in the brain's dopamine system, which is involved in regulating movement and mood. Other factors that may contribute to restless leg syndrome include iron deficiency, kidney disease, pregnancy, medications, and genetic factors. Iron deficiency is one of the most common causes of restless leg syndrome, and it is estimated that up to 25% of people with restless leg syndrome have low levels of iron. Iron is essential for the production of dopamine, and low levels of iron can lead to reduced dopamine activity in the brain, which may contribute to restless leg syndrome. Pregnancy is another common cause of restless leg syndrome, with up to 25% of pregnant women experiencing symptoms. The exact cause of restless leg syndrome during pregnancy is unknown, but it may be related to hormonal changes or iron deficiency. Medications, such as antidepressants, antipsychotics, and antihistamines, can also cause restless leg syndrome as a side effect. In some cases, the symptoms of restless leg syndrome may be a sign of an underlying medical condition, such as kidney disease, diabetes, or peripheral neuropathy. Diagnosis of restless leg syndrome. There is no specific test to diagnose restless leg syndrome, and the diagnosis is usually based on the person's symptoms and medical history. A doctor may also perform a physical examination and blood tests to rule out other underlying medical conditions, such as iron deficiency or kidney disease. The International Restless Leg Syndrome Study Group has established criteria for diagnosing restless leg syndrome, which include an irresistible urge to move the legs, usually accompanied by uncomfortable sensations in the legs. The symptoms worsen at rest and improve with movement. The symptoms occur or worsen in the evening or at night. The symptoms are not caused by another underlying medical condition.
Before we continue, don't forget to subscribe to our channel for more videos like this and turn on notifications so you never miss one of our health videos.
Treatment options for restless leg syndrome. There are several treatment options for restless leg syndrome, depending on the severity of the symptoms and the underlying cause. Lifestyle changes. Making certain lifestyle changes can help alleviate the symptoms of restless leg syndrome, including regular exercise. Exercise can help reduce symptoms by improving circulation and increasing dopamine activity in the brain. Avoiding caffeine and alcohol. Caffeine and alcohol can worsen the symptoms of restless leg syndrome, so it is best to avoid or limit them. Warm baths. Taking a warm bath or using a heating pad can help relax the muscles and reduce the symptoms of restless leg syndrome. Massage. Massage can help reduce the symptoms of restless leg syndrome by increasing blood flow and relaxing the muscles. Medications. Several medications are available to treat restless leg syndrome, including dopamine agonists, which are a class of medications that are commonly used to treat restless leg syndrome, as well as other conditions related to dopamine dysfunction in the brain, such as Parkinson's disease. Dopamine agonists work by stimulating dopamine receptors in the brain, which can help alleviate the symptoms of restless leg syndrome. Here are some examples of dopamine agonists drugs. Pramipexole, Mirapex. Pramipexole is a medication that stimulates dopamine receptors in the brain, which can help alleviate the symptoms of restless leg syndrome. It is usually taken once daily, about 2 to 3 hours before bedtime. Ropinirole, Requip. Ropinirole is another medication that stimulates dopamine receptors in the brain. It is usually taken once daily, about 1 to 3 hours before bedtime. Rotigotine, Nupro. Rotigotine is a patch that is applied to the skin once daily, and it releases dopamine agonist medication over a 24-hour period. It is usually applied to the thigh or abdomen. Apomorphine, Apokin. Apomorphine is a medication that is administered by injection, and it works quickly to alleviate the symptoms of restless leg syndrome. It is usually reserved for severe cases of restless leg syndrome that do not respond to other treatments. Dopamine agonists can be effective in reducing the symptoms of restless leg syndrome, but they can also have side effects. Some common side effects of dopamine agonists include nausea, dizziness, fatigue, and sleepiness. Less common but more serious side effects can include hallucinations, compulsive behaviors, and sleep attacks. It is important to work with a doctor to determine the best treatment plan for restless leg syndrome and to carefully monitor any side effects of medication. Dopamine agonists should only be taken as directed by a doctor, and they should not be stopped suddenly without medical supervision, as this can lead to withdrawal symptoms. Other examples of medications are iron supplements. If the cause of restless leg syndrome is iron deficiency, iron supplements may be prescribed to increase iron levels in the body and improve dopamine activity in the brain. Anticonvulsants. These medications, such as gabapentin and pregabalin, can help reduce the symptoms of restless leg syndrome by reducing nerve activity in the legs. Opioids. In severe cases, opioids may be prescribed to relieve the symptoms of restless leg syndrome, but these medications carry a risk of addiction and dependence. It is important to note that medications should only be prescribed by a doctor and taken as directed, as some medications can cause side effects or interact with other medications. Natural treatment. There are also some natural treatments that may help alleviate the symptoms of restless leg syndrome. However, it is important to note that these treatments may not work for everyone, and they should not replace medical treatment prescribed by a doctor. Here are some natural treatments that may help relieve the symptoms of restless leg syndrome. 1. Exercise. Regular exercise can help reduce symptoms by improving circulation and increasing dopamine activity in the brain. Low-impact exercises such as walking, swimming, or yoga may be particularly beneficial. 2. Stretching. Gentle stretching before bedtime can help relax the muscles and reduce the symptoms of restless leg syndrome. 3. Massage. Massage can help reduce the symptoms of restless leg syndrome by increasing blood flow and relaxing the muscles. Self-massage or using a massage ball or roller can be effective. 4. Hot or cold therapy. Applying a warm or cold compress to the affected area can help reduce symptoms by relaxing the muscles and reducing inflammation. 5. Essential oils. Some essential oils, such as lavender or chamomile, may help promote relaxation and reduce the symptoms of restless leg syndrome. Adding a few drops to a warm bath or diffuser may be beneficial. 6. Magnesium supplements. Magnesium is an important mineral for muscle and nerve function, and some studies suggest that magnesium supplements may help alleviate the symptoms of restless leg syndrome. It is important to note that natural treatments may not work for everyone, and they should not replace medical treatment prescribed by a doctor. It is important to talk to a doctor before trying any new natural treatment, particularly if you are taking any medications or have underlying medical conditions. In conclusion, restless leg syndrome is a neurological disorder characterized by an irresistible urge to move the legs or other body parts to relieve uncomfortable sensations. The exact cause of restless leg syndrome is unknown, but it may be related to abnormalities in the brain's dopamine system, iron deficiency, or other underlying medical conditions. There is no specific test to diagnose restless leg syndrome, and the diagnosis is usually based on the person's symptoms and medical history. Treatment options for restless leg syndrome include making certain lifestyle changes, such as regular exercise and avoiding caffeine and alcohol, and taking medications, such as dopamine agonists and iron supplements. It is important to work with a doctor to determine the best treatment plan for each individual, as some medications can cause side effects or interact with other medications. If you are experiencing symptoms of restless leg syndrome, it is important to talk to a doctor, as early diagnosis and treatment can help alleviate the symptoms and improve your quality of life.